Hello, welcome to HBI 2026. I'm Rakshitha. I'm a journalist with Healthcare Business International. We have here with us Klaus Schuster, who's the Group CEO, Vitrea. Welcome, Klaus.
Thank you.
Many thanks for being with us today. Klaus, I have three questions for you. What is the role of rehabilitation in modern healthcare systems?
So first, thank you for the invitation, and let me explain to you about rehabilitation. So in my view, rehabilitation is really the, you could say, socio-economic motor and engine of the healthcare industry. Why is that? You have to imagine, as we all know, with aging, the population over 65 is growing. Yeah. On the other hand, workforce is shrinking. And rehabilitation is the only patient pathway or part of the patient pathway where we can directly decrease and reduce the economic burden and rise productivity. That's one hand. On the other hand, rehabilitation is also an asset class for investors, which is very safe, very secure, and has a lot of opportunities. Because, for example, in the DACH region, we are reimbursed by public health insurances, public pension fund, so a very stable long-term financing. And in addition to that, due to the demographic shift, there's a growing demand, meaning you have stable financing, you have plenty of opportunities, there's a consolidation in the market ongoing, so there's good growth potential as well.
So how is rehabilitation evolving, and what key trends are shaping the sector?
So, as always, it's about digitization, one of the big factors. So we are moving a little bit from the traditional occupancy-based model to what we call hybrid outcome-based model, meaning we are focusing more on the patient needs, and we try to include the several aspects, meaning our stable backbone is inpatient rehabilitation, but we are also focusing on outpatient, and now we are also offering digital rehabilitation. So it's really the entire pathway in rehabilitation. And I think this is extremely important because it's really covering the different needs of the patients. And this we do in Vitrea with 80 facilities. We are operating in Switzerland, Austria, and Germany. We have around 14,000 staff, mainly of them medical staff, nurses, therapists. So those are doing the job on the ground. And we are really focusing on this personalized care because in the end, what we do is we treat patients. Maybe to give you an example. So after stroke, your life is saved in an acute care hospital. But then in rehabilitation, once again, you learn how to walk, how to grab something, how to swallow. So in the end, rehabilitation gives you and brings you back to life. And this is what we want to achieve. And with that, we also want to make sure that we really focus on the patient needs because this is our most important problem.
Very interesting. So what are Vitrea's strategic ambitions in this evolving landscape?
We are already quite big in the DACH region, but we really want to be the leading rehabilitation provider. And leading means not only in size, but also in steering and creating something new in rehabilitation or making sure that rehabilitation is really seen as an integral part of the patient pathway. This is what we want to do. And with that, we try to capture this demand, having this kind of hybrid models. How do we do that? In the end, it's about digitization, having a unified IT system as well, and having an organizational structure where we can scale. On one hand, to the patient needs, but it also allows us to grow in an organic and inorganic way. And this is also our mantra, stronger than before, because that's true for the patient, that's true for our employees, but that's true for the company. And with that, we try to shape the rehab business overall in Europe.
Wonderful. Many thanks, Klaus, for being with us today.
My pleasure. Thank you so much.